Famotidine suspension is a medication used to treat ulcers in the stomach and intestines, and to prevent the return of intestinal ulcers after they have healed. It is also used to treat certain stomach and throat problems such as erosive esophagitis, gastroesophageal reflux disease, GERD, and Zollinger-Ellison syndrome. This medication works by reducing the amount of acid produced in the stomach, which can help relieve symptoms like persistent cough, stomach pain, heartburn, and difficulty swallowing. Famotidine belongs to a class of drugs called H2 blockers. The recommended daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. When taking famotidine suspension, final dose form, peptic ulcer agents, it's important to follow your doctor's instructions. You can take this medication with or without food, usually once or twice a day. If you're taking it once daily, it's usually best to take it right before bedtime. Before each dose, make sure to shake the bottle well for 5 to 10 seconds. Use a special measuring device or spoon to carefully measure the dose. It's important not to use a household spoon, as you may not get the correct dose. The dosage and length of treatment will be based on your medical condition and response to treatment. In children, the dosage may also be based on body weight. If needed, antacids may be taken along with this medication. To get the most benefit from famotidine suspension, final dose form, peptic ulcer agents, it's important to use it regularly. Try to take it at the same time each day to help you remember. Do not increase your dose or use this drug more often or for longer than prescribed, as it won't improve your condition any faster and will increase your risk of side effects. Even if you're feeling better, continue to take this medication for the prescribed length of treatment. If your condition does not improve or worsens, be sure to inform your doctor. If you experience headache, constipation, or diarrhea, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. Be sure to contact your doctor right away if you experience easy bleeding or bruising, signs of infection, or mental/mood changes. Additionally, seek medical help immediately if you experience a very serious allergic reaction or any very serious side effects like irregular heartbeat, severe dizziness, fainting, or seizure. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And as always, if you have concerns about any side effects, consult with your healthcare provider. Before taking famotidine, make sure to inform your doctor or pharmacist if you have any allergies to famotidine or other H2 blockers. It's important to discuss any medical history, especially if you have immune system, kidney, liver, or lung problems, as well as any other stomach issues. It's important to seek medical help immediately if you experience heartburn along with lightheadedness, sweating, or dizziness, as well as chest, jaw, arm, or shoulder pain, especially if accompanied by shortness of breath or unusual sweating, or if you experience unexplained weight loss. Before undergoing any surgery, be sure to inform your doctor or dentist about all the medications and products you are using. For older adults, it's important to be aware that they may be more sensitive to the side effects of this medication, especially mental or mood changes, seizures, or unusual tiredness. If you are pregnant, only use this medication if it is clearly needed, and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using this medication if you are breastfeeding. It's important to be aware of potential drug interactions with famotidine suspension. This medication can affect how well other products work, especially those that need stomach acid for proper absorption. It's essential to inform your doctor and pharmacist about all the products you use, including prescription, non-prescription drugs, and herbal products. Avoid taking this medication with other products that contain famotidine or other H2 blockers like cimetidine, nizatidine, or ranitidine. If you're taking medications like fezolinetant, atazanavir, dasatinib, azole antifungals, levodocaconazole, pazopanib, or sparsentan, consult your doctor to ensure the effectiveness of your treatment. Remember, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much famotidine suspension and is experiencing severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important not to share this medication with others. In addition to taking this medication, making lifestyle changes like reducing stress, quitting smoking, cutting back on alcohol, and making dietary adjustments, like avoiding caffeine and certain spices, can help improve its effectiveness. Discuss with your doctor or pharmacist about lifestyle changes that could benefit you. While you are taking this medication, your doctor may want to conduct lab and/or medical tests, such as endoscopy or kidney function tests. Be sure to attend all medical and lab appointments. If you have any questions, consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take an extra dose to make up for the missed one. It's important to store famotidine suspension at room temperature, away from light and moisture. Make sure to throw away any unused medication after 30 days, and do not store it in the bathroom. Keep all medications out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company on how to properly discard this product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.